This one here's for my peoples in a promised land that never planned to free you, designed to keep you curled in the feeble. Stay strong, brother, we need you. This one here's for my peoples in a promised land that never planned to free you, designed to keep you curled in the feeble. Stay strong, sister, we need you.
Welcome to Powerful Impact, where we interview people who made a powerful impact on the culture, music, and the community at large. I'm SP, and I'm here with Nev, and we have a special guest, Ayana Ali. It's wonderful that you're here because I think that we don't talk about mental health enough, you know, especially in our community. So I am so grateful that you came today, and I can't wait to get into the topics.
Thank you. I'm glad to be here.
So I'm just going to start off with where are you from originally, and how does that affect your work?
So I'm originally from Brooklyn. I still live in Brooklyn. I've basically lived in Brooklyn my whole life, except for a few short periods of time where I lived elsewhere. But you know, Brooklyn is in my veins. I love this this borough. I love the people of Brooklyn, and I think the way that it shows up in my work is that, you know, obviously I'm educated. Obviously, you know, I've gone to school and I can speak the King's English, but you know, I can also I speak like a Brooklynite. Obviously, I have an accent. I didn't realize I had an accent until I was about 20 years old, and I went to stay in Rhode Island. I was lived in Rhode Island for a summer, and everybody was like, "Oh, you have an accent," and I was like, "No, I don't. What are you talking about?" So I'm just real. You know, I use a lot of Brooklynese, and you know, I think I bring a realness to my work that people can appreciate. I think especially people who are originally from New York, but definitely people who are from Brooklyn.
So how did you decide to get into the field of mental health and you know, eventually become a therapist in the private sector?
So my story, I mean, maybe I don't know if it's unlike many other people's story. So I have a sister. She's 2 years younger than me, and you know, it was the two of us and our parents. And when we were, I think I was about 18 and my sister was about 16, my mother was diagnosed with breast cancer. And it was something that kind of really like shook our family. You know, fortunately, she's still here. She's a 25 or 26 year survivor. But at the time that she was going through her treatment, our family was kind of like in a tailspin because, you know, as most families are, the mom is the center and holds everybody together. And, you know, our mom was sick. So we had decided as a family that we wanted to go and we wanted to talk to a therapist. And so we went as a family to see a woman who is an LCSW. She's a Black woman. She's very successful. She practices in Brooklyn, worked a lot with, you know, Black families. And she, you know, worked with us around our fears and our doubts and, you know, kind of all the emotions that we were going through and knowing that our mom was sick. And it was very helpful for us to kind of just come together and be able to, in a safe space, say that, you know, we were scared, we were worried, all of those things. And that's those couple of sessions that we went to with her were very, not only healing for me, but they were very impactful for me because here I was, you know, in a mental health setting across from a woman who looked like me and a woman who kind of, you know, my family is mainly from the South. She's from the South. So not only, you know, was she a Black woman, she was a woman who was familiar with a lot of like our cultural norms and family values and stuff like that. And so that was so powerful for me, you know, because I think what we had seen on what we were used to seeing on TV were, you know, these images, these very like austere and kind of like clinic, like sterile kind of like depictions of what it's like to be in therapy. And here this woman was warm and, and it didn't feel weird or odd. It didn't feel like she was judging us. And it felt like she really could understand what we were going through. So for me, it was a good experience, but it also was an inspiring one because I was like, hey, I like what this lady is doing. It got me interested in mental health. And then I went to college and I got a degree in psychology. I found that I only really liked the social aspects of psychology. I didn't like the science part of it, cognition, perception, any of that. So I didn't know if I would be a good candidate to get to pursue a PhD. And someone told me about social work and that there was something called clinical social work where you could learn to be a therapist, but you were also looking at the person in the environment and seeing how kind of the larger environment impacts people's individual lives and outcomes. And then also worked especially with people in marginalized communities or people who tend to, get the short end of the stick. So it kind of appealed to everything. And then I remembered that the therapist that we had seen was a licensed clinical social worker. And I was like, oh, that's what she is. That's what she was. So that's why I decided to pursue social work as opposed to psychology or anything else. And, I think all those years back when I had that positive experience, it kind of put a seed in my head. And then kind of my educational endeavors and also my personal interests in like the Black community and working with marginalized people, they kind of all came together in social work. And so that's how I got into this field.
That's pretty dope. That's kind of my path into being a psych nurse was I worked hospice for so many years, and to see the trauma that happens with children that had losses, I say, well, let me, divert myself into another direction. So I know how it is when you have something that hits you and you're like, yeah, I made a change at 40. So
That's nice.
What are some of your specialties in the population that you work with?
So I'm a Black woman. Obviously, I love working with Black women. I love working with women who are, similar to me. But within that, I mean, and obviously I work with everybody, but my heart and soul really is in working, specifically with Black women. And I work a lot with people who suffer from anxiety and depression, which is unfortunately very common in the Black community. And unfortunately, it's very common for women to deal with anxiety and depression, whether it's related to family or career. And I think that the way that Black women experience anxiety and depression sometimes looks different. So that's the population that I really, focus on. And some of my work is around how to manage anxiety and depression, at least specifically how it shows up for us. Another of my kind of areas of interest is around racial trauma. So I have run in the past like racial trauma support groups for Black women and for people of color. And we talk a lot about kind of work situations, what it's like to be a person of color in a corporate environment, or not even necessarily in a corporate environment, sometimes in the education system or anywhere. But what's it like as a Black person to be in an environment where you are not the majority, and you do have to deal with overt sometimes and sometimes subtle racism, and how that affects self-esteem and how that affects how we view ourselves, and how comfortable we are in those spaces, how it affects our ability to feel successful. So I do a lot of that kind of work. And then something else that I do that I'm really like growing this niche is working with women who suffer from infertility and pregnancy loss. That is part of my own personal journey. And I found that when I was going through those things, I had doctor to talk to or a surgeon to talk to, but nobody really was checking up on me in terms of my mental health after every time I had a loss or when I was struggling, to grow my family. So I've been doing support groups for women who suffer from pregnancy loss and infertility. And I'm actually in January going to be seeing a new support group for couples who are dealing with infertility and pregnancy loss. So those are really my areas of interest. And that's usually where my work centers on.
Oh, okay. So what is some advice or I hate to say a blueprint, but more like more like a
process.
Process. Yeah. You would give or leave behind for someone who's interested in getting into the field of mental health?
Well, I mean, I think one of the things that I would tell people is that, there are many ways to work in mental health, right? Not everybody has to be a therapist. You can be a nurse. You can be a case manager. And I think that sometimes that's something that is not necessarily expressed to people. The field of mental health is large. So I would say to people, if you're interested in mental health, and you think, you view yourself in the mental health field, what do you view yourself doing? How do you view yourself participating in that field? And then, can you match that up with a specific discipline, or can you match that up with a specific, a career trajectory? And then can you put yourself on that path by either studying in that discipline or applying for a job in that realm, and then, giving it a chance and seeing if you really like it. Oftentimes when people want to go to school for, to be in mental health, they don't know what to do. They're like, should I get a psychology degree? And I would recommend that people really look at the different sets of programs and kind of what the focuses are, or, what the groups, you can do individuals and families, you can do with social work, at least, sometimes you can do individual and families, you can do policy, you can do administration, what's the area that you really see yourself working in or that you're really interested in, and then look at the the curriculums and see if you can find one that aligns itself a little, more closely to what you want to do. It used to be that social workers were kind of on the low end, with like the bottom of the totem pole in the field of mental health. That's not really the case anymore. And so, I always make a plug for social work, because social work is a really versatile degree. You can do a lot of things with a social work degree. You can work in a lot of settings. But I think, talking to people, asking people kind of, what do you do if you know that somebody works in mental health, and then, seeing how closely what they're describing that they do or what their interests are align with yours is one, good way to kind of get your feet wet. What else? Yeah. And I think, one of the things that I want to stress to people is that you don't have to get a PhD to be a mental health, worker. Some people are really, they're afraid because they don't want to get a PhD. I didn't want to get a PhD. And at the time when I was in graduate school, a PsyD was something that was kind of new, and I didn't know that much about it. So I was kind of like, what am I going to do? And then I realized, I can, get a master's degree in social work. So you don't have to spend 6 to 8 years in graduate school to work in the field of mental health to be efficient and to be a proficient mental health worker. So that's also another bit of advice I would give people.
Do you have to go $500,000 in debt?
Right.
Yes.
Right.
It's been a decade, and it will be called a doctor.
That's right. There are a lot of good community colleges and universities where you don't have to pay an arm and a leg to get your degree, and you will be just as qualified as anybody else, and you can pass licensing exam just like someone who went to an Ivy League school. I went to a very pricey school, and I'm still paying my loans today. I don't regret it, but sometimes when I look back on it, I'm like, maybe I could have just gone to I got into Hunter College. I didn't go there. It was much cheaper than the university that I went to. And sometimes I wonder what my life would be like if I had made a different choice, terms of finances. So
do you feel like you chose your career, or do you feel like your career chose you?
I feel like a little bit of both. I think that I, people who know me know that I'm like, I was raised in a very power to the people kind of household.
Mhm.
And by my dad. And I have a lot of that's an aspect of my personality. So I feel like, even if I hadn't gone into mental health, I probably would have been doing something that I feel like serves the community directly and, in a more direct way. I definitely think that experience that I, described to you at the beginning was life changing for me. So I think in some senses, like that experience was mental health's way of choosing me, because it showed me like what I could do for other people and or who I could be for other people, and so that was an inspiration. And I also think that I had these dreams of kind of maybe being a psychologist and being doctor. My maiden name is Johnson, Dr. Johnson. And then I realized, oh, there's this thing called social work, which, and this is not in any way putting down psychologists or psychiatrists, but I was like, there's this thing called social work, which really captures like the heart of what I want to do. So I feel like I had a very good friend who was going to social work school, and she started telling me about it. So in that way, I feel like, the discipline kind of chose me too, because I got all of these messages about like, this is where you should be and you can do this. So.
Oh, cool.
Yeah.
What is some advice you'd give to someone thinking that they should go to therapy? And they're kind of on the fence about therapy.
Yeah.
What kind of steps do you think one would go about setting up the appointment with the therapist or for an initial consultation?
So the first bit of advice that I would say is like, if you're thinking about going to therapy, go. You really don't have much to lose by going. You have a lot to possibly gain. I would also tell people that, I think people have this idea that, I'll get into therapy and I'll be working with somebody forever and ever. And if it's a disaster, like I have no way to get out of it. And that's not the case. It's the same thing as if, you choose a new primary care physician and, for whatever reason, you don't, jibe with that person, you can always make another choice. So if you're thinking about going to therapy and sorry, I have a dog. And you try to, enroll in it and then it doesn't work for you, you can always change to someone else or explore other options. And so, one of the things I think that we don't spend enough time explaining to people is how to get into therapy in the first place. Sometimes people are like, oh, I need to talk to somebody, or, I need help, or a friend may say to them, girl, you need to go to therapy. You need to work your issues out, but nobody ever says how to do that. So one of the, the easiest ways to get enrolled in therapy is if you have health insurance. You can usually look on the back of your health insurance card and there's a customer service number that you can call, and you can just let them know that you want to be transferred to the behavioral health department or the mental health department, and they will transfer you to the department whose job it is to explain your benefits to you, help you find a provider, let you know if you have a copay or not, let you know if there are certain limitations on the number of sessions or the type of clinician you can see. That mental health arm of your health insurance is really kind of, a huge resource for you, which you should access because you're paying a premium for that insurance. And, you need to be able to get the information. For people who are not insured, because we know that, insurance can be expensive. And for some people, they don't have it. You can reach out to like your local community center. You can reach out to your local hospital. You can sometimes reach out to your religious organization, a church, a synagogue, a masjid, a temple. Very often they have mental health resources that they can put you in contact with. So, there's all kinds of ways of getting hooked up with people, whether you have insurance or not. There are often many free or low cost therapies that can be offered in community service centers or at hospitals. So, people shouldn't let the lack of insurance be a deterrent either for whether or not they will engage in treatment.
Mm-hmm. So, I think we have a big problem in our community about understanding that in any kind of healthcare, you are the consumer.
Mhm.
And a lot of times I hear people saying, I hate my doctor, or, you know,
Right.
they never seem to be interested in what I'm doing.
Right.
How important is it that you find a fit with the therapist that you're going to engage with?
It's really important. I mean, your therapist is part of your medical team or your wellness team, right? So just like you said, people will sometimes say, "Oh, I don't like my doctor." And some people choose to say, or some people will choose to look for someone else. You should feel as entitled to look for a therapist that you feel would be a better fit for you, just as entitled as you feel to look for a different doctor or a different dentist or anything like that. Because the ease and the comfort that you feel when you're with that person is going to influence whether or not you're really going to be honest with them, whether you're going to be forthcoming, whether you are feeling that you can say something that about which you may have some shame or some guilt. If you're not
Mhm.
comfortable, you're not going to be the real authentic you. So, if you find yourself in a situation where you feel like this is just not working for me for whatever reason, know that you do have the right to explore and look elsewhere. There are lots of websites that are devoted to finding clinicians, whether you're looking for a clinician of color, whether you're looking for a clinician of a specific religious, kind of background, or whether you're
Mhm.
looking for somebody who identifies as part of the LGBTQIA community. I mean, and if whatever you're looking for, there's a way for you to find that person online.
Yeah.
Also, you can ask your friends. Many, you may have friends that are in therapy and they may be able to say, "Oh, I know of this therapist who's really good," or "I know of this therapist who works on this specific area of interest." You know,
Mhm.
um, you keep seeking until you find what you like. And
Mhm.
if you don't like a particular therapist, you don't feel comfortable, it doesn't mean there's anything wrong with you. It also doesn't mean there's anything wrong with the therapist. It just may mean it's not a good fit, you know? And so just move on.
And you have the right to move on. It's so often that people, well, they're the doctor, or and then but I always tell people it's very important that you advocate for yourself,
Mhm.
because especially being a person of color and being a woman, nobody's going to advocate for you.
Right.
Sometimes you have to have that friend come in with you so they
Mhm.
can hear exactly what you're hearing and give
Yeah.
you feedback. So I think people have a kind of standoffish when it comes to mental health, because they don't really understand that just because someone sent you to this particular person doesn't mean you have to stay.
Have to stay. Yeah. I mean, and the thing is like, therapy is a relationship, right? So
Mhm.
I care about my clients and they care about me, and we work together. But when it all boils down to it, I work for my clients, right? So I'm
Mhm.
supposed to be performing a job for them, and I'm supposed to be helping them achieve some type of result. If that's not the case, if one of my clients feels like she's not as helpful as I want her to be, or
Mhm.
I really want somebody who, practices this specific brand of therapy, they have a right to say that to me and ask me, what my thoughts are about it, or ask me if, we can introduce something else into the treatment plan. And if I can't do it, or if I'm not comfortable with it, or, we try and it doesn't work out, they have a right to move on, because nobody has time to waste. I think if
Mhm.
anything, with COVID and with, all that's been going on in the last couple of years, we realize that life is short. You
Mhm.
don't stay in something that doesn't feel good for you, whatever it is.
Yeah. So there's all of these new things that are popping up, and I think for a lot of people in our community, mental health is something that you kind of put to the side. And so all these new phrases and words and all of this stuff is coming up. So can you explain to the audience the difference between a life coach, a therapist, a social worker, a counselor?
Right.
So they kind of know exactly where they should go.
Yeah. So a therapist, is a person who works with people around a specific diagnosis or a specific set of problems through talk therapy, typically, sometimes through, another type of therapy, but their goal is to help address, a mental health diagnosis. Now, a therapist can be a social worker, they can be a psychologist, they can be a rehabilitation counselor, they can be a CASAC, they can have a particular discipline or a particular area of study, that they've mastered. But all of those, they can be a nurse practitioner, anybody who is helping you by making a diagnosis, doing an intake, making a diagnosis, and then is trying to help you navigate life in light of the diagnosis that you've been assigned through meeting with you on a regular basis and creating a treatment plan is a therapist. Now, each of the disciplines that I've mentioned to you has a particular kind of slant or lens through which they approach their work. So I'm a social worker, and social workers, our real area of focus is the person in the environment. So I'm going to give a diagnosis. I'm going to talk to you and try to help you come up with a plan with how you can, learn to function at your best in light of that diagnosis, or working with that diagnosis. But in addition to that, I'm looking at your overall environment, and I'm wondering how the outside environment or the inside environment, like your family system or, your work system, how those things are impacting how you show up in life and how you navigate that particular diagnosis or that particular set of problems that you came to me for. A psychologist might be doing something different. They might be looking at, your personal psychology, or what your personal kind of approach to life is and how you apply that to the outside world. So it's a different focus, but we all are capable of doing therapy. When you ask about like counseling, typically counseling is a little bit different in that it's not necessarily psychotherapy. The idea of psychotherapy is that I'm working with you to help you come up with the answers, that will help you improve your life and better your functioning. Counselors, in the true sense of the meaning, tend to give more advice and tend to give more direction, let's say, than a psychotherapist would, because they have a specific area of expertise and their job is to educate you about that and provide you with a little bit more direct guidance. So, it really depends on what you're looking for. Sometimes, we as a social worker, licensed clinical social worker, there are times when I might be giving counseling to a client of mine because I might think in this particular area they really need it. So it's also sometimes like we wear different hats, if you think that you need a particular type of clinician with a particular type of training, I would encourage you to seek that person out and find out if that's the case, but there's a wide variety of professionals within the mental health community, and they all do something slightly different. I don't think anyone is better than the other, though. I think you can be helped by any of those professionals with any of those disciplines.
So what about affordability? How can potential clients find therapy that's affordable and doable for their pockets and budget and lifestyle? Specialists can be really costly. So how do you find the clinician that's going to be affordable or comfortable for your budget?
So this is when I would say that these like search engines that I referred to a little bit earlier are really your friend, because some of these websites you can go and you can add filters. And so you can say like, I'm looking for a therapist in Brooklyn who's a Black woman who charges between, $50 and $75 per session or less than that, or, who speaks a specific language. So, if finance is a concern, you can kind of put the range, or if you have a certain type of insurance and you only want to use your insurance and as opposed to, let's say, paying out of pocket, then you can put, I have HIP or I have GHI, and then you can click that insurance, and the list is only going to give you people who accept that particular insurance. So then that if you're seeing that, any of those clinicians that came up on that list, that all you're paying them, let's say, is a co-payment as opposed to paying the whole entire cost of the session. Many clinicians also view taking insurance as a means to providing access for clients. So I'm in New York City, on Fifth Avenue or Madison Avenue. There are lots of therapists who maybe charge $350 per session. I mean, that's great, but that's not the population that I'm targeting, right? So there was a time when I didn't take insurance at all, and I think that affected the number of people who were coming to me. I wasn't charging what I consider to be a huge amount of money. I was charging like $100 per session, but for some people, that's just too much, right? So then when I decided to get insurance panels, it was a win-win because there were more people who could come to me using their insurance, and there were more clients that I could work with, right? There are also some clinicians who, whether they're charging like $350 a session or whether or not they're on insurance panels, they also set aside a certain number of slots for clients where they will maybe charge a nominal fee, or where they will sometimes give like a pro bono service where they won't charge at all. So, there are people out there who are committed to doing the work for people who, maybe don't have insurance or maybe can't afford it. There are also many organizations where they are applying for and being given grants, and they may actually pay for the services, for people to get therapy for free. So in the past, I've worked with organizations where they applied for grants, they were given money, and that money was utilized to pay the clinician who then gives the therapy, and all the clients who come to the therapy don't pay. So there's, the way to do it. Yeah.
So what are some of the pros and cons of being an African-American and female therapist in the field of mental health?
I don't think there are any cons. I'm a Black woman, so I'm not gonna say like, it's not a con. It's who I am. I think, but if we want to be like real, depending on the setting in which you're trying to seek employment, you may encounter people who think, you're not as qualified, or, you're not as well trained. I found that that's less of an issue these days than it was maybe 10 years ago or 20 years ago when I was getting my degree, because there are people who are specifically looking for Black women or Black male clinicians who, work in this area or work on this issue because of who they are, and because level of not only clinical acumen, but also real life experience that they can bring to the setting. So, I mean, I think it's a great time to be a Black clinician. I think it's a great time to be a Black person. But I think it's a great time to be a Black clinician because more and more people saying like, I want to work with somebody who looks like me, or I want somebody who has a background that's similar to mine. So, we're in demand much more than we ever were. But I think, whether you're a therapist or whether you're a doctor, whether you're a teacher, regardless of what your field is, there always will be, racism that you will encounter wherever you go. Yeah. But I'm not going to say there's anything bad about being a Black woman therapist, because there's not.
So what are some of the pros and cons of being an entrepreneur, owning your own practice?
Okay, well, there's definitely some pros and cons to that. I mean, I think the pros are, you're working for yourself, right? You can decide which cases you take on. When you're starting out in mental health, most people work in like a clinic setting, or most people who want to do psychotherapy, wind up working in like a mental health setting, a clinic setting, or like a hospital clinic setting. I mean, in those instances, typically you don't have much of a say of which clients and which cases you're going to take on, right? When you work for yourself, you can be like, oh, this population I'm good with, this population I'm not as strong with, I'm not going to work with this population at all. Or, you know, I really enjoyed this work, so this is what I'm going to focus on. You don't always have that ability when you're working for other people. So you have the ability to really like create a niche for yourself and create an area of expertise. And then after you've been doing this work for a while, you can be like, I'm an expert, because you know what? I am. You know, I got my degree 21 years ago, and you know, probably like it took me till like 2 years ago to really own the idea of like, I'm an expert. You know, I'm an expert in what I'm doing. But you know, I think some of the cons can be that, you know, depending on how much you charge, or depending on the, you know, the number of people who are seeking you out for services, you may or may not be making the amount of money that you want. You know, obviously for people who did not believe in virtual therapy when the pandemic hit, it was bad, you know. Some people were very anti the idea of virtual therapy. And so if you weren't willing to do that, how were you going to work with your clients? You couldn't. You know, so, you know, there are always things that you kind of have to like work out when you're working on your own. Health insurance, pension, you know, like dental benefits, like those kind of things can be a real barrier to self-employment for people. And, you know, there are ways to go about it, but it can be tricky. It's also information that usually you have to pay money to get and to learn. So, you know, depending on your financial situation, if you're not making a lot of money in your practice, and let's say you want business coaching, or you want an accountant to come in and, you know, help you do your books, you know, it may be difficult. Another thing that can be difficult about being self-employed is that, you know, when you work for somebody, you get a certain amount of sick time and vacation time and all of that, right? So, you know, as long as you don't go over the limit, if you don't go into work for a day, you're still going to get paid. Or if you decide like, I want to go to Mexico for a week, you're going to get paid. When you work for yourself, you don't get paid if you don't do a session unless you have passive income. You know, you have other means of making passive income. And that's something that, you know, mental health workers don't usually get taught. We get taught the clinical pieces and how to do diagnosis and how to do engagement. We're not taught how to like run a business, or, you know, or the ways that you can make multiple streams of income. Nobody teaches us that. You know, we usually have to seek that information out on our own. I mean, so, you know, that can be difficult. But like, I have a 5-year-old daughter. You know, I tend to work between certain hours, and then I stop working, and then I go and I pick her up from school. There are 2 days where I have somebody come by and stay with her. My mom and my dad live really close. They stay with her and help her with her homework, so I can see some more clients the rest of the afternoon. And then there are other days when I just work up until 2:00 and then I'm done for the day. That's one of the great things about being self-employed, you know, is that you can set your schedule. So, you know, it's really about like how you see yourself working and how you can make the money that you need to make so that you can live the way you want to live.
So before you went into your own practice, what were some of the populations that you worked with?
So I've worked in a lot of settings, but I've worked a lot in homeless services. My first jobs, I worked in a city sponsored women's shelter, and it was a program within a city run shelter for women who were chemically addicted and mentally ill. Then I've worked in preventive care. I worked in a program that was trying to prevent families from being separated and children being placed into foster care, and then was also working with parents and children when children were returned, trying to help them, you know, children remain in the home. I've worked in a lot of different mental health clinics when I was trying to get my license. I've also for many years worked at a labor union. So I was actually providing social services within, under the umbrella of a union. I was working with retirees, so I did like geriatric social services at the union. So I worked with people who were transitioning into retirement. I helped them transition from work life into retirement. I also had a specialty that I had kind of developed where if there were people who were going to be filing for disability retirement because of the onset or the worsening of a mental illness, I would work with those people. So I would not only help them fill out the applications, but I would coordinate like the mental health evaluations and psychiatric evaluations that they needed so that they could qualify for a pension. And I did a lot around like Medicare and Social Security and stuff like that with that population also. And then I started working with the active members of that union and doing things like mental health referrals, crisis intervention. So the union represents city employees. And so sometimes things would happen at the work site, like there might be violence in the work space. I would go and do intervention and debriefing. If someone passed away, either at the job or, at their home, but the colleagues were affected by that death, I would go in and do bereavement sessions and things like that. So I've done a lot of that kind of work. I also worked for 9 years for a large social service organization where I did a lot of things, different jobs there. I led an in-house mental health consulting team. So they had like residential programs and clinics and ACT teams and all kinds of programs. And I led the team that would come in and do some like consulting for the case managers who ran those programs. And then sometimes we would be like doing evaluations for people determining if they needed to be hospitalized. So unfortunately, sometimes I would have to have people hospitalized, but the people who were working with them were not clinicians and maybe weren't sure. I did a lot of like professional development education also at that organization. So I did something called Understanding Mental Illness, where I wrote a curriculum about some of the mental illnesses that you see most often in our populations, and explaining it to them, explaining to the workers who didn't have clinical degrees, how to recognize signs and symptoms, how to communicate with people therapeutically, some of the things like if someone's delusional, don't dispute the delusion, because it's something that can automatically, put distance between you and the client. I also worked for home care agencies where I would go into the home and I would do evaluations about, if a home health aid was needed, and if so, how many hours. And I also did in-home mental health evaluations for children. So I've done a lot of things.
So, what exactly is mental health? Or a mental health disorder? Mental illness in general.
So mental illness is when there is a specific set of symptoms or experiences that someone experiences that's usually partially biologically based. So sometimes there's too much of a certain chemical in the brain, or not enough of a certain chemical in the brain. But it's usually biologically based. And then it also has a environmental or psychological component as well. And it's a constellation of symptoms or experiences that interfere with daily functioning. So, for example, lots of people are like, oh, I'm anxious. Yeah, there's a difference, though, between being anxious because you have an exam coming up next week and you have to study really hard for it, and then having anxiety to the point where it's very hard to concentrate on a task, or it's hard to sleep at night because, you wake up in the middle of the night and think about all the things that could possibly go wrong, or you are so afraid of encountering something specific that you actually develop an aversion to it. Like you're so afraid of countering terms that you don't want to touch doorknobs, or you don't want to touch, you don't want to shake hands with people. And because of that reason, you stay away from people or you stay in the house. That's anxiety to the point that it's interfering with, your daily functioning. You're making friends or going out to work. And so when it interferes with functioning and with the living life the way that they want to, and it's something that, is based in biology and psychology, that's what we would call a mental illness. So depression, for example, is different than being sad. We all have things about which we feel sad. Maybe we might even cry about them. Maybe when they come up for us, we feel emotional, but we're able to kind of carry on with our daily lives. Depression, however, is when there's sadness and there's lack of motivation and there's kind of an actual like slowing down, or what we call psychomotor retardation, where you're so heavy and you're so weighed down by the things that are bothering you that it's hard to get out of bed, or maybe you sleep all the time, maybe you can't sleep, maybe you're eating all the time, or maybe you don't have an appetite at all. It's thinking things like, oh, I didn't do a good job on that presentation. It's, I'm worthless. I shouldn't be here. I don't contribute anything to the world. Those kind of thoughts and that kind of dysfunction obviously gets in the way of people living their lives. So that's where you can say this depression is a mental illness versus sadness is an experience that most people can feel or can have happen, but then they can kind of move on from it without intervention. Whereas a mental illness typically requires intervention in order to be able to function better in light of those symptoms.
So when should someone seek help if they have depression or anxiety? How would you know it was time to seek help? And for, especially for therapy, because I find a lot of PCPs will give their clients, give their patients the psych meds,
right?
And I just don't, in general,
agree with that. Yeah,
PCPs aren't trained to handle psych. So it's a very specified area of expertise.
Right.
So can you explain to people when they should seek that help and why it's important to find someone who's trained to diagnose and treat mental illness rather than going to their PCP?
Right. So, I mean, I think, to go back to something that I said a few minutes ago is that, if you're experiencing sadness or anxiety or any kind of symptom that you feel is interfering with your daily functioning, you're not able to live your life the way you want to. You're so anxious that, you can't sleep, or you're so anxious that you have to go over the same thing over and over again. You're ruminating. That's the moment when intervention is needed. If it's something that you can feel anxious for a little while and then you can shake it off, or you can feel sad for a period of time and then you feel like you can kind of just, put those thoughts and those feelings in their proper place and move on, then it's probably not something you need to seek therapy about. But if it's something that's impacting the way that you want to and do live your life, that would be a sign that you would need, to seek help by talking to a therapist or a psychiatrist. As far as finding someone who has that level of expertise, I agree with you in that, PCPs usually do not have the level of training around psychiatric medication to be administering and writing scripts for people on a long-term basis. Sometimes there are PCPs who know a little bit about it, and they may, based on their interviews with their clients, say, you're really anxious or you're really depressed. I'm going to write you this script. But the responsible thing for them to do is to say, but you need to seek, a prescriber, a licensed prescriber. I'm going to give you this script right now because I think, you're in distress, but I'm not going to continue to write the script for you for 6 months. You need to see a psychiatrist or you need to see a psychiatric MP. You should also be talking to a therapist, So some of the dangers are that sometimes people think I just need to be on meds. Sometimes people think I just need to be in therapy. And what we know from the literature is that the two usually work together better than one or the other. And, so if you're not sure what type of, clinician you need to work with, you can, once again, contact your insurance company or contact somebody who has that expertise. Ask them and hopefully they'll point you in the right direction. Obviously, you always want to be working with someone who's licensed or who is working under the supervision of someone who's licensed, because you'll know that person has passed a test or has been mentored by a professional with more expertise in that field at some point. And so that the quality of the treatment that you should be receiving from them should be of a higher caliber.
So can you take us through a typical intake session, or a regular session with the therapist? What takes place usually?
So I think it depends on where you're going for your treatment. When I've worked in mental health clinics, every mental health clinic that I've ever worked in and every mental health program that I've ever worked in, even if it wasn't a clinic, has like a huge set of documents with a huge set of questions, forms that you have to sign, and sometimes those intakes are done in one session. Sometimes they're done over a period of a couple of sessions. Every program is different. And it's really the questions that they're asking you are designed to get a comprehensive kind of overview of not only what is happening with the client right now, but kind of their previous experiences with any treatment, their upbringing. They want to know a lot about you. And, I understand why programs do that, especially programs that are under the auspices of certain certain bodies like OMH or, the Department of Health. They have to make sure that the assessments that they're doing with clients are comprehensive and that they're giving accurate diagnoses and things like that. What I find when you're working, as a private practitioner, is that when people are reaching out to a private practitioner, they don't want to talk for 4 sessions about, when they were growing up 20 years ago. They want, they're coming to you with a very specific problem or concern. They want to begin talking about that right away. Does that mean, though, if you're a private practitioner, that you don't ask questions or you don't get to know clients? No, it just means that you're not going to sit there with a piece of paper and check off the questions. As you're meeting with the client over a couple of weeks, you're trying to learn a little bit more about them. So official intakes tend to be lengthier and tend to have very specific questions that they're going to ask. Most initial sessions with private practitioners are more focused on what we like to call the presenting problem, or the thing that the person, had in mind when they reached out or sought therapy, or someone told them to go. A first session for me looks more like just a conversation with that person or that potential client about what's going on with them. A regular therapy session for me with the client could look many, many ways. It could be a conversation where we're laughing. I use a lot of humor. I think my clients think that I'm funny, and I sometimes tell not jokes, but we have things that we laugh about in session. Sometimes the sessions are a little bit more serious, and it's like we're creating a plan, like maybe a crisis intervention plan, or we're creating a list of points that a client wants to make sure that they mention in having a very important conversation with someone in their personal life or in their workspace. So, the sessions can look differently depending on what the needs of the client are, and, what they're looking to work on in that particular day. There are times when I let the client direct the sessions. There are other times when I feel like I have to make a point, that I observe something that's very important to share, and then I may be a little bit more directive, or I may do a little bit more talking in those sessions with the client.
Oh, okay. So can you explain neuroplasticity and how the brain can change through the use of words and new thought processes?
Yeah. So, neuroplasticity is basically the brain's ability to kind of create new connections or to kind of rewire itself. And so, in essence, when we're talking about neuroplasticity, what as therapists, as talk therapists, what we are talking about is creating new patterns of thought or new of behavior that the client will put into practice on a regular basis. And that repetitive kind of reliance on thinking a new type of thought or doing a specific type of exercise, whether it's like meditation or whether it's mindfulness, has actually those processes have actually been found to create new pathways in the brain. So if I'm a person who tends to feel guilty and feel ashamed of myself quite often, but then I start working with the therapist, and the therapist presents me with other ways that I can view myself or other ways that I can evaluate myself. The therapist might actually have you might have me work on affirmations. So when I feel shame or when I feel guilt, they might actually have me say, I don't have anything to be ashamed of, or, I'm a good person who makes mistakes but is worthy, and whatever the language is, the particular language is not always important, but the fact that you're thinking a new thought and you're assigning language to that process, if you do it often enough, it actually creates new connections. So over time, your brain begins to not associate thoughts with yourself so much with guilt or with shame, but with the good things that we've identified in therapy. That's like healing. The brain is healing itself through therapy. It's very powerful.
Excuse me. So how can talk therapy help reduce feelings and symptoms of anxiety and depression without the use of medications?
Well, oftentimes in general, people, when they feel anxious or they feel sad or they feel shame or they feel guilt, they may not want to talk about those things. So one of the most basic ways that therapy can help with those things is by giving you a space to talk about them, but in a safe way, right? Because, let's say someone is feeling suicidal. Most people talk about their suicidality or their suicidal ideation because they're afraid of being judged, or they're afraid that they will make those people with whom they're sharing those thoughts and feelings concerned or worried. So they just keep it in. But if you go to a therapist and you're talking about those things, and the therapist actually, one, doesn't judge you. One doesn't say that, experiencing suicidality means you're selfish or means that you're weak. And then two says, three says, I'm going to help you try to work on a way to manage these thoughts and feelings. That's taking a big weight off of somebody's shoulder who's been carrying all of that around on their own. Just opening up communication is something that's really good. I think one of the things that is common when people are so anxious or so depressed that they're consumed by those type of thoughts is that they get to the place where all outside or alternative types of thoughts just don't occur to them. Like they're so stuck in this kind of repetitive and consistent way of thinking negatively that they can't entertain other thoughts, or they can't come up with them on their own. So what therapy does is kind of brings in another person who might say, oh, but this is what you're thinking. Is there another way that we can look at that, or is there a possibility that the way that, you're interpreting it may not be what's going on here, So therapy provides alternative perspective that is so hard for people to kind of come up with on their own. And I mean, not everybody needs medication, right? The research shows that for people who are truly in distress and their level of functioning is quite compromised because of a mental illness, that usually medication and therapy work best together. But some people just need a space to bounce ideas off of, or some people just like need to be able to ask somebody, this is what I'm thinking. Does this make me sound crazy? Like, not everything requires medication. But the job of a competent therapist is to help the client kind of figure that out, and sometimes as a therapist, I will say to a client, I want you to talk to a prescriber. I don't know if you need medication, but I want you to just talk to a prescriber and then see what they say, So it's not always that you need a script. But, it's good to have someone competent who will share with you when they think that you may need one, and who also give you very specific tools and coping mechanisms that you can combat the depression, the anxiety, or the phobia, or the PTSD, whatever it is. Their job is to provide you with tools.
So last month was Men's Mental Health Month. And statistics have shown that African American males in particular have had a spike in suicide rates. And the rate has actually doubled within the past year of the pandemic.
Right.
What factors do you think have contributed to this spike and increase in suicide rates, particularly among African American men in America?
I mean, I think the two things that I can think of right off the bat are COVID, the pandemic, and the George Floyd and Black Lives Matter movement, that have kind of risen to, national recognition or actually worldwide recognition, and the acknowledgement that racism is really a problem here in the United States, all over the world, but particularly for the United States. We have this real moment about the acknowledgement of racism and how damaging it is. I think that the pandemic, we know that it was very hard on Black people. It was very hard on people of color, but it was, particularly hard on Black people in terms of joblessness, in terms of loss of income, in terms of, because of loss of jobs and income, loss of health insurance, loss of housing. We know that food insecurity was something that, millions more people than on average, than normal were not having access to food. And, and it was something that affected the Black community, to a greater extent than any other community. So of course, if you have COVID and it's impacting Black people negatively, of course, you're going to see the impact on Black men, right? Because we know that Black men, it's almost like they're an endangered species, and that, there's so much threat to their physical safety and emotional safety. Then when you pair that, on a regular basis, right? And then when you pair that with COVID, and you pair that with so much disparity in terms of, treatment availability and assistance in terms of financial assistance and things like that, it makes sense that Black men would, those problems would show up much more in the Black male community. I think, additionally, in terms of the Black Lives Matter movement and, everything that was happening after the death of George Floyd and Breonna Taylor, it was good in the sense that there was this acknowledgement, for the first time in a long time, this real acknowledgement that there are serious problems with racism in this country. But I think that while a lot of good work was done as a result of that, the deaths and the manner in which Black men died at the hands of police and died at the hands of racists, it was like shoved in our face over and over and over again. So once, people became aware of George Floyd's death, and then they became aware of Breonna Taylor's death, it seemed like every other week we were seeing something on the news about a Black man being shot, a Black man being killed on camera, and still, charges not being filed, or still convictions, not being handed down in large part. And since Black men are killed more often by the police and are killed more often in racist incidents, imagine being a Black man seeing this on TV all the time. And on the one hand, seeing people try to fight for justice, but on the other hand, seeing blatant instances of racism play out on video, and still nothing is done. That's enough to make you want to, like Marvin Gaye said, that's enough to make you want to holler. So of course, that sadness and that trauma, it's traumatic to look at the news and see someone shot. Last week they had the Ahmaud Arbery, the trial for the people who killed Ahmaud Arbery, and I hadn't seen those videos in so long. And then when they were showing them, because of the deliberations, I was like, oh no, I can't. I had made a very serious effort to not watch that kind of stuff on TV, and it had kind of died down. But then you were being bombarded with those images again with the trial. There's no way that anybody who is even halfway alive could see people who look like them being mistreated and being, abused and killed on camera and have it not affect them. Because if I were a Black man and I'm seeing these things on TV, I would be afraid to be outside. I would be afraid that if I were ever wrongfully, arrested or accused by the police of doing something, that there might not be resource or recourse for me. I don't know how you can be a Black person and be halfway conscious and not be affected on some emotional and psychological level by what we see happening to people who look like us every day.
My mom always says, my mom always says that we are bombarded by America's fetishization of Black snuff porn. That's what she calls it.
Really?
It's constant, and it has been this way for years. And, since she was a child. And she said she feels like it is a way that America uses to keep us in our place, because this is what will happen to you.
For sure. I mean, the trial of the officer who shot, I think it's Dante Wright is his name. That just started, right? And so of course you're seeing this discussed in the news, again. And I guess I never feel like at some point last summer, I kind of just stopped listening so much or as carefully to these stories. So I knew about Dante Wright and I knew what had happened with him. I don't think I ever knew why he was stopped in the first place. So I was listening to the news this week and it said that he was stopped because of a broken taillight or something like that, or some minor infraction. And then I guess when they pulled him over, they said he had a warrant or something like that. But I'm like, why do you have to pull somebody over for a broken taillight? It's so inconsequential, And so we know that the police stopped him for something that's really not important. And we know that he was shot on camera. We know that he had a 1-year-old baby. We see all of this and we're constantly exposed to these images. And then we're just supposed to move on with our day, And if you're a young Black man or a young Black woman or an old Black man or old Black woman, what's the effect of seeing that and then having to just go out and live your daily life? I live in a pretty, diverse and neighborhood and it's safe and everything in Brooklyn. And I remember I was pulled over by the police because I didn't know they were police. They were like in an unmarked car. I wouldn't let them cut me off. So then they, put the the siren on and pull me over, and they're like shining the flashlight in my car, and I was petrified. And then the only reason they left me alone was because they got a call on their radio about something and they drove off. Now I'm living in a neighborhood that's safe and it's decent and whatever, and I'm afraid of being pulled over by the police. Imagine people who live, in what's sometimes referred to as the ghetto, or as areas, predominantly Black or brown areas. Like, you feel even more scared, places like that,
Mm-hmm.
We have to carry this every day.
And a lot of the times when you're in those type of areas,
Mm-hmm.
when crime does happen, I'd rather deal with the crime than the police. So it's a lot of times that even crime is not reported because I'd rather take my chances with the criminal.
Yeah, you don't want to invite the police into your world unnecessarily.
Mhm.
Because you know if it's going to wind up causing, more harm than good. I mean, so imagine living in an area like that where, if something was done to you, depending on the severity of it, you might choose to just ignore it or try to deal with it on your own because you're afraid of asking for intervention, and you have to, you're living in this area day in and day out. I mean, the psychological damage that does to people on a regular basis, feeling like the police don't care or getting the police involved will make things worse. It's traumatizing. It's traumatizing, and everybody expects Black and brown people to just, go out and deal with that every day and be good,
Yeah, don't talk about it.
Yep.
We're watching all of this stuff unfold on TV, and it's we already know that it's traumatic, and yet so many people are denying that it even exists. So can you kind of please explain to people what is systemic racism?
So, I mean, systemic racism is not just racism where, you may walk up to somebody and you may call them a slur, or, you may discriminate against somebody because of their rate, their race. Systemic racism is institutional. So it's racism that has larger levels of power behind it, and it has the ability to affect, whether people are employed, whether people eat, whether people receive quality medical care, quality education, whether people receive good mental health care, whether people are taken seriously when they report that they have pain at the doctor. It affects people in terms of the justice system. So, it's something that affects larger groups of people, and in an institutional way. The basis of the racism is practiced via an institution, the medical institution, the justice, the educational system.
And so institutional racism is on a large scale.
Right.
What does the term microaggressions mean?
So a microaggression is, it can be something that's said, it can be something that's done, that can be subtle or indirect, but that is discriminatory or is done as a result of someone's race. So it could be something like, let's say you're you're going to hire, you're an HR person and you're going to be interviewing people for a particular job, the job of a physician, and you come out into the waiting room and you're asking for Erica Brown, and there's a Black woman sitting there and then there's a white woman sitting there, and you as the interviewer go up and say Erica Brown to the white woman, and then the Black woman says, no, I'm Dr. Brown. You know, it was a subtle assumption that because this woman was Black, she couldn't be the doctor that you would be ready to be interviewing, that it had to be someone white, right? And not only, you know, what was it that she couldn't be the doctor, but it was not even acknowledging her at all. So not saying, good morning, ladies. Which one of you is Dr. Brown? You know, it's going totally ignoring the Black woman and then going straight to the white woman and making an assumption that because of who she was racially, that she had to be the person who had the advanced degree and the medical training. So it's something where the person's not saying, oh, I'm assuming you're the doctor because you're white, and I'm assuming you're not the doctor because you're Black, but that's what was conveyed, right? Or that was the thought process that was behind the action. So that's an example of a microaggression. Another example of a microaggression, something that personally has happened to me in the past, where I worked at an organization and I ran a department, and I was talking to a couple of people who about staff, some of my staff, and I don't know, somebody didn't come in or didn't call in or something like that. Someone didn't follow protocol in another department, and we were talking about that. And I just said something like, if that was one of my staff members who had done that, I would have, taken disciplinary action. And a white woman who was in this conversation with us she said, no, of course you would have said something about it because you're mean. Right. And I said to her, would you have said that if I were white? Because all I said was that as the supervisor and as the director of this department, if I had a staff member not show up or not follow protocol about calling out sick or letting me know that they weren't going to be in, that I would take disciplinary action against them. Is that me being mean? And if a white person had said that, a white woman had said that, would you have accused her of being mean? Or is it because I'm a Black woman, you assume that I'm mean and I have an attitude, and that's why I would be going, against these staff members? So it's little things like that that are really based assumptions or based on ideas that are born out of people's racial identity.
Yeah, I worked in a facility where I was the only Black person in the whole complex. And all of a sudden, every time I walk in the room, everybody like, hey, girlfriend, what up, girl? I'm like, number one, I don't even talk like that. What is wrong with you people?
Right. The assumption that that's how you speak Black, right? Mm-hmm. Yeah.
Sassy.
And, yeah, the sassy Black woman.
Mm-hmm. Yeah. Or the assumption that you're more comfortable speaking that way, right? Mm-hmm. That's how they have to get in with you by calling you girl and being a homegirl with you, as opposed to being a professional and just saying, hi, good morning, how are you?
So sometimes microaggressions can be the extras that are added. The extras, that's what it could be too.
It could be extras, yeah. It could be, attributing things or adding things onto people's character, or adding reasons or attributing, reasons that people do something because
angry Black woman, angry Black male.
Right.
Sassy black friend.
Right. Or sexy Black, whatever it is.
Yeah.
It's assigning people stereotypical roles or stereotypical behaviors when they haven't demonstrated that that's where they're coming from, simply because they're a member of a particular racial group.
Yeah, Hollywood does it all the time. You can have a complete white cast, and then there's always one sassy Black friend, or the Black savior of the movie, who all of a sudden saves everybody in the whole film,
right?
As if that actually exists.
Yeah. Yeah. So I mean, microaggressions are like slights that people, And sometimes they're intentional and sometimes they're not, but they're based in racist ideals and values.
So we talked about the constant showing of Black death.
Mm-hmm.
And in thinking about that, can you explain race-based trauma?
Yeah, so race-based trauma is trauma that people experience as a result of their race, as opposed to because they're a woman or because they're a man or because they're a doctor or because they're a lawyer. And it's very specific. And it's something that cannot be experienced by someone who is not a part of that racial group. So it's unique and it's inherent and it's a shared trauma that's experienced by members of a particular group. So an example of race-based trauma is, the sense of traumatization that Black people carry around with them all the time because they're frequently bombarded with images of people who look like them being shot, being killed on camera, or or the trauma that Black people carry around and internalize because when, there is a death by someone who looks like them at the hands of the police, the idea that nothing's going to happen to those police officers, they may not even go to trial, or if they do go to trial, we know that they're going to get off because we know that the system doesn't work for us. That expectation that life isn't going to work for us in the way that it would work for our non-Black counterparts, and that sense of disappointment, that is an example of race-based trauma that is specific to us.
So just in general, how have these terms played out for you in your profession or just your personal life?
Well, I mean, I think, first of all, I believe that there is such a thing as race-based trauma. There are certain people who work in the mental health field that don't, that think it's not a thing. It's like racism and discrimination has always been a topic that is very important to me, and it's something that's always been very distressing. And I think the fact that I have space in my career to acknowledge for people that this trauma that they're experiencing, one, is real, and then provide the space for them to talk about those things and to, get some of that out, out of their body and out of their mind into the outside world. I'm honored that I can do that, because I think that there's so many clinicians who do not provide that type of space for people. And there's so many people who feel that trauma and feel that race-based sadness and stress, and then will go to a clinician who doesn't look like them, or sometimes even does look like them, and be told, oh, you're making that up. Oh, you're just too sensitive. Or maybe they didn't maybe that's not why they did that. Maybe that's not why the security guard followed you, So there's this gaslighting, that happens, this like psychological gaslighting that happens to a lot of people, particularly a lot of Black people, where, no one is even acknowledging that what they're feeling is real. So for me to be able to say it's real, you can talk about it. And also we can try to figure out ways to combat it so that you get it out of your body, so it doesn't drag you down and damage you, physically. I'm just so happy that I can do that, because there are a lot of people who need that. And they can't find the space to have, they don't have that space to talk about those things.
So how can we combat this on an individual micro level, and as a community on the macro level as people of color?
Well, I mean, I think on the micro level, like I just talked about it, people are in individual therapy and they're in individual conversations with their friends and their family. and there's somebody saying like, we acknowledge this is real. I want to hear your thoughts and your feelings about it. The way you have been treated is wrong. You know, the pressure and the stress that you live with every day because of this race-based trauma is damaging, and it's a real thing. So that's how we address it on a micro level, right? On the macro level, what we have to do is we have to encourage universities to, train mental health clinicians and doctors and teachers about systemic racism, and train them to, one, get familiar with the literature and what it says, and that this thing is real. And then we have to encourage them to make sure that white clinicians, as well as clinicians of color, because, it's not, in my opinion, not possible for me as a Black person to be racist, but it is possible for me to embrace, ideas of internalized racial oppression, and then put that on my clients, right? So what we need organizations to be doing is to be teaching about systemic racism, the effects that it has on people's psyche, the trauma that it causes. And then we need to see that curriculum be part of licensing exams. You have to demonstrate that you're proficient in recognizing what race-based trauma is and treating it. We have to educate people about this. It has to be part of the curriculum. It has to be part of, organizations, bylaws. And, it's not just about take one cultural competency class and then you're fine. It's about, we have to be constantly challenging people who hold power, because as a therapist, I hold power because, there are people who are going to be like, oh, she's smarter than me, or she knows exactly what's going on because she's a therapist, even though that may not be true, but I hold some kind of power. So I must be educated, right? When it comes to organizations that provide services to people, Black and brown people, we need to make sure that these programs are not being inherently racist. We need to make sure that if there's a detection of systemic racism in these programs, and in terms of their guidelines and in terms of the rules and regulations, that it's called out and it's corrected. So policy, education, those are ways that we can affect these things on a macro level.
So this is Powaful Impact.
Yes.
What 3 people provided a powerful impact in your life, professionally and personally?
So I talked to you guys about the therapist that was helping my family. Her name was Ella Harris. Ella Harris LCSW, practitioner in Brooklyn. She definitely had a powerful impact on me. I should also say that when I decided to become a social worker, I went to her and I asked, I said, I want to go to social work school. And she looked over my personal statement and she kind of was like, these are the type of words you want to put in. This is the language you want to use. So not only like was she helpful to my family all those years ago, but then when I wanted to pursue my education, she was helpful to me. So she definitely had a powerful impact on me. That's Ella Harris, LCSW. 2, I would say my dad. I mentioned earlier that my dad is like really power to the people kind of guy. And my sister and I have a sister who's 2 years younger than me. We were just talking the other day about how when we were younger and my father would talk to us about racism, and he would talk to us about kind of like, the difficulties that Black people experienced. When we were younger, we thought that he was kind of like exaggerating, or when he would say things about racism, or he would say things about how white people often show up in this world. We'd be like, oh, not everybody's like that. Oh, don't say that. And then the older we became, and the more experiences we started to have for ourselves, we realized that a lot of the things that he, used to tell us when we were growing up were true, and that he had some very important points to make. And I think that were it not if I didn't grow up in the house that I grew up in, I don't know. I can't say that I wouldn't have become a mental health, somebody in mental health, but I definitely don't think that my eye would be focused on like the social justice aspects of it. And I also think that I've always been really vocal about racism, and that's because of my dad. So I'm grateful for those experiences. Who else? I would say my sister, probably. Actually, you know what? I want to say my daughter. Let me say my daughter. I have a 5-year-old daughter, so she's only been around for 5 years. I'm 44. Obviously, I've lived a lot more years without knowing her than I have knowing her. One thing I will say about her is that she's a mirror to me. Like she shows me the good, the bad, and the ugly, and she loves me anyway. And I think that that's like a powerful message that parents can learn from their children, that my daughter knows like all my faults. She's happy to point them out. she knows all the times she knows all the times I messed up. She's happy to point that out. But she loves me in spite of that. She loves me exactly because of how I show up in the world, right? And our jobs as therapists is to say to people like, it's not all roses and flowers. There are aspects of your personality or the way that you show up in the world that can be problematic, but you are uniquely you, and you're still inherently good, and you're still inherently a blessing to this world. And that's what my daughter has shown me. So
daughters are very good at showing you,
yes, who you are, right?
Yeah, especially I know mine often tells me, you do realize that you can't always be right, that you are human.
Yeah. Well, I think one of the things that's humbling for me with my daughter is that, my best friend, who's her godmother, she's like, she's just like you. And I'm like, no, she's not. She's frustrated. She's like, she's a mini you. So yeah.
Ditto. She's a mini me.
Mini me. Yep.
Which I don't know if that's all good right now. Sometimes I just like, shut up.
Right.
I don't need me right now.
Right. Ma'am. I need you to be somebody else. Exactly. Yeah.
So when all is said and done, what do you want your legacy to be?
I think I want my legacy to be that I was a therapist that let people know that they're whole already. I think like people come to therapy, there's something wrong with me, and one of the things that I say a lot to my clients is there's nothing wrong with you, there may be things you want to do differently, or there may be other ways that you want to approach life, but there's nothing wrong with you. You're not damaged, you're not broken, you are whole. And there are parts of you, that are whole that you maybe have a harder time seeing. My job is to help you see that. So I would hope that when people think about me, people who have worked with me, that they'll be like, oh, that was a therapist who treated me with decency, who didn't judge me, and who really like showed me an accurate picture of who I was. And so she didn't try to fix me. She just wanted me to be more of who I really am.
I just want to thank you. This is something that I think our community really needs. And we really need to focus on mental health, because we have so much trauma that we're packing around every day. Yeah. And it is affecting us. And you see the effect. And we're so used to not dealing and just, we have to march forward,
Yep.
that we are silently suffering when we don't have to.
Yeah.
And
Absolutely.
you're so important. And I really appreciate you coming on here and spreading your knowledge, because these interviews aren't easy. It's a long time to sit and talk to somebody, but I really appreciate you taking your time and explaining it in layman's terms for people to really understand the importance of mental health.
Thank
Is
you.
there anyone?
Sorry.
Is there anyone you'd like to give a shout out to, or anything you're currently working on that you'd like to talk about?
Yeah. So I think I mentioned at the beginning that I regularly run support groups for women who are suffering from infertility and pregnancy loss. And so I, in the past, I've done that on a more ongoing basis, but I've decided to make them kind of shorter periods of time. So in January, I'm launching another iteration. That's them. Another iteration of that. I'm sorry. I'm also going to be putting together a group for couples who are suffering from infertility. And I have a lot of professional development work that I'm looking to. So I'm looking to connect with organizations who want me to come in to
so cute.
I don't know. Sorry. Yeah.
You're fine.
So
You're
yeah.
fine.
Okay. So I'm
We
listening.
love the puppies.
Yes. Sorry. Come, baby. Yeah, so that's what I'm trying to do. I'm trying to grow my groups and work with some organizations around some of the topics that are really important to me: racism in the workplace and microaggressions and things like that.
So what are your contacts in the way people can get in touch with you? And we're going to put them in the description. So if anybody wants to speak with her, all of her information will be in the description. But if you can give them your information and where to find you at.
Sure. So my email is Ayana Ali LCSW @gmail.com. So that's AYANA ALI, L as in Larry, I as in igloo. I'm sorry, L as in Larry, C as in cat, S as in Sam, W as in Walter, Ayana Ali LCSW @gmail.com. My website is www.ayanaalilcsw.org. You can find me on Psychology Today. You can find me on a website called helloalma.com. And you can find me on Instagram at Ayana Ali LCSW. So you can also probably just type my name in, Ayana Ali LCSW, into Google, and it'll take you to one of my pages. So
it's been spectacular having you here. I really enjoyed this conversation. This is kind of a personal baby for me, mental health. And I think it's important. And I think that we have suffered in silence for so long. And it's time to step out and really deal with the trauma and really understand, so that we can step out into the world fully adjusted and ready to kick its butt.
I agree. Thank you so much for having me today. It's been so nice talking to you.
I want to thank everybody for tuning in to Powaful Impact. Again, I'm SP. We got the man behind the blue wall up there now. And we ask you to subscribe to our YouTube channel and follow us on social media. Tonight, you kind of saw the beginning stages of us as a community healing ourselves. I want to thank Ayana Ali. This has been a pleasure. I so appreciate you.
Thank you for having me. I appreciate it. Good night, guys. Bye-bye.
Good night.
Good night. Go out there and make a powerful impact in your community, everyone. Bye. Boom.
Toast and cheers abundant, my dear beloved, truly love us. Taking the view and just admire the beauty of us. Rich in pigment, in spirit and accomplishments. Not the monoliths synonymous with impoverishment, imprisonment, and pain. We're presented as lift black leather clad fists and everlasting praise for the courageous liberators, demonstrators, educators, innovative creatives, the nurturers, entrepreneurs, and organizers who remind us to keep our heads pointed skyward. Survivors who can testify that the sentiment of never forget has never been lent to our genocides in this nation. Under greed, divisible, hypocritical, conditional creeds and principles, peer pressured patriotism, pledges of